a correlation to adverse childhood experiences. So it's important if you, and we can even put the stuff up for you. We can give you these resources and information on this. Do you guys want to add to that in terms of childhood?
I can, if, I don't know. Yeah. So this is one of the first things that I go to is when I'm working with somebody is asking them about these foundational experiences, because what most people don't understand is people say, oh, I've already worked through my childhood, or I've already dealt with that. When in reality, it's like, there's so much, this is your foundation. This is what all of your patterns of your life have been built over. And so if you don't go back and recognize your own patterns or what happened to you and come to an understanding of how that affects you now, then you're missing a huge portion of that. I mean, that can be in a safety component of not feeling safe. And so your body doesn't feel safe and you stay in a fight or flight component for your whole life. So there's that aspect of it. The other interesting part is that looking at embryology, we develop, especially the gut is a big one. We develop out of the enteric nervous system. It's one of the first things that develops. And when you are in utero, your subconscious or your conscious mind and subconscious is directly connected to your mother and every experience that she has had during that pregnancy. So if your mother is having traumatic experiences or having difficulty, your gut will then develop out of that. And that can be the reason why so many people have difficulty in childhood and later on with gut issues.
Interesting. And I know at some point, hopefully we'll touch on, so a lot of people are saying, but then what do we do about it? Or how can we facilitate improvements, or what's our role in all of this, right? And the other component of it is there are many of us out there that are clinicians who maybe have dealt with trauma or issues as well. And what do we bring in when we work with patients and clients? Are we affecting care because of we have our own traumas that we're walking around with, that sort of thing?
Oh, I'm so glad you mentioned that, Tracy, because I think there's this narrative in healthcare where we're supposed to be, as clinicians, as providers, like this blank slate. And when we walk into the room, that none of our baggage, none of our cultural conditioning applies anymore. But if we haven't done that work on ourselves, there's no way that we can just be this perfect reflective shield to our clients. Like our impulses, our biases are going to show up in how we interact with our patients. And so, like, absolutely, we have this trauma of our own to deal with before we even begin to talk about our patients' trauma. And so often that conversation is not being had at all.